na eno health talk no yes sa eni kakra ene ende ka hypertension ho asem yenka diabetes yenka asthma be na ye pese ye ka se emergency bi eto se bia o fi ana se onam kwan so ana o care mu ana se regimen bi ato bi wa wo ho no emwa ben a wo uni medical training bia ana medical knowledge bia emwa ben na obutumi amasa nipa no kosi se ebia yemfa se doctor ana obi a owo nimdi ewo apomoden hu ebeba nti is it working? I know what move, man. So move. All right. Quickly. Alright, nti nyama na yebeka ho asem no edoso nti yebeko no teto nyama na ho hia Nkansah no na stress on nti yo fainting say obi na ho ana obu ahwe yo choking obi gidi na atrano na akoshe no na dependent on home ekwan ben so na obutumi aboa no say bia bends o fina oba ana obi ho ahye ekwan ben na obetumi aboa san nipa no you bleeding say adie twa obi amana koma moje to ana ona nkwan so accident atu obi obetumi aboa no kakra bleeding ena fracture so obi enam ho na bebe abono ana se watwa hwe ana waboho na bia na mu abu ana ne nsem abu ana bebe atu no kwan ben so na obetumi aboa sa nipa no ena last time we cardiac arrest heart attack you see ubinya heart attack or from no so no sa no be fi opanyi bi o fi anase young person bi heart attack achi or be na o from no kwan ben na obutumi afa so aboa sa ni pano nti yakasi fainting is known as syncope. It's a sudden and temporary loss of consciousness typically caused by a temporary decrease in blood flow to the brain. Time epache ane se normally skeka so bia fentia e chese nipa no we lose consciousness nti oni me ekoso ewo ne mpatemu or around him, and the reason why people will faint and say moja we say akoma no ebo a edistribute moja eko other parts of the body, especially the brain. And to say nipa no se moja a edeko na adwene no reduce a ebetumi ama nipa no lose consciousness or one nipa no twawe. And is normally triggered by factors such as dehydration, low blood sugar, emotional stress, sudden changes in position, or underlying medical conditions. Inti nyama ebetumi ama obi twawe one say bi nipa no only issue like esukoma de nature only issue one system nim etima obi etwahwe say nipa no sugar ewo ne moja no very low ema etima nipa no so etwahwe afi so nipa no why stressed pa enso tumima nipa etwahwe afi so ebi medical condition say bia hypertension and I be beside a nipa. So sometimes to me get to the point and nipa be trash. And see, in order to help, people when they faint, first I saw to me who means and nipa fainty. And so we do a few more. First I saw who if the nipa no diabetes. If I say diabetes, it's a chair. If you put it there, almost far or more drona. Now, a caution like almost far or more drona, the infant say, if you need any system, it to me is a sugar or homogeneous. So when you take the medications, it's trying to bring down the sugar. But sometimes you may take the medications when you're not taking any food, it can actually reduce your blood sugar drastically, significantly. So sometimes no more for my drone and now we be enter into some stress. It can trigger a collapse. So now we see trash. What I say? It's say caveat necessary. Nipa no is because of say a sugar and a bad down system one. Say nipa no ebe wa say we diabetes. Today be so nipa no the whole day like a common nipa like we did the whole day because of how are you busy so the whole day you show a perfect crank and sugar being in the system. The same panel, sana what you do first, they say, over try so the bony panel. It's a fan say, Kojo. It's it's a bony panel, India, or just so maybe to make Kasaka cry. You can know that probably sugar and alcohol. Decide panel to me, Amano. At Nasi, now one a sugary drink to be to cook. This woman cook no man. It's not sugar and a basu. A basu we are now one again say kinky and now by and now like proper food will be able to maintain sugar. But I say so we have to note say any intrasidian mediane to be intrasidian comedian. Then the panel conscious are obey to me at shoki because nothing is going on in the system. It's so naughty. Say niche or diabetic and I'm sugar bathroom. And I said the whole day why you busy, sir, why you stress, why qua only do the whole day. Now open the panel or just so or say like but say Nkansah no and to toss papa. No I'm a panatnasi. Oman cook. And I any sugar and our malt but cook no sugar no in the dose. Tell man the panel I would any consciousness in time. Ofa cook na ensi wa uwa na wapa eduane papa ma no ama nipa ne do sa nipa bo say after 30 minutes we do why fine why fit so na wona oko odi akonya ba ne ade but you can say but say other causes ebu ha it could be from other causes nti ono sa no say oda ho na bia obo na nipa ne ntumi and respond there. What you do is because say I was a major called brain no. This called the vasovagal syncope. A sense of some major called brain no to me or the whole flatter. But you it's your friend said the penetration. If you trash and no trash, you see. So, and I say, the way you trash is not in the correct position. Over than the panatusi. And then you have to make sure say the sound and so there's safety. Like be any open, be any way to me pony pan. Into one say one panada hosino. All that hosino cry to me increase blood to the brain. Lying this way can actually increase blood flow to the brain. Now I feel between amani naso to man and so kosora and also between ama moja nako brain and to normally 2 to 5 minutes don't say nipa no are okay utumi asorogin na so onante why okay just by doing this. Baby try to only make us then ekoso no time waste. But you tell something out there, hey doctor you after now ambulance baby away 1 hour 30 minutes later. But just by like lying the person down, say they are diabetes, say they are just by sitting up the person. If you are panel, no man cook, be not managing, a bit me saving the panel. And as I say, diabetes, and yes, sugar and alcohol from now, say like with trash cooking. You can just lie the person down on the floor, then raise up the legs. Just this can save the person. That's what I say. That's what I say. In say which me who ete de bi so na fainting ni bi o ha na ano de bi a hypertensive emergency. Nti e ba sa nyama na bia wa ye we no within 2-5 minutes bi be see immediately fanipa no tika mu fa no hospital. That's what I say. Immediately, if after 5 minutes why are you wada flat what pejana nine still no respond immediately men can who cry fancy taxi mu fa no hospital streets no want to make brown. But you say I told the so na and you do you feel the CPR and by my last year I can have and nti na mka elevate the legs nti ohwe na nipa no so ebia o shit tell me ebia in say yebra poor issue na nipa no order from 150 you can loosen the tight clothes to be big in the buttons so the buy from the fan and maybe about time you tie no to be big in the buttons so the buy if I'm able to me fan now feel so o yes na ohwe nipa no say ohune Mr. Nkansah say if after 5 minutes nipa no respond or home the brain see fancy care na fanako hospital because yes now show breathing so breathable say the chest no cause never from cause never but if after 5 minutes we say the beyond cause the one nipa no not say not breathing na enko the BRAC then you know that you have to do something we call CPR and then the last thing I make am yanko. Alright, into that will be all for fainting. Into first, say unenipano, diabetes, I want to so. Unenipano, the whole day, unidi, nipana stress, you move it up and down, up and down, up and down, up and down, up and down. We say sugar brain in the system. Obono. Kojo, maybe I just so. What's it then? You say, oh, na if I say sugar in the system. But what nipano? Nkansah on your BBI, then you lie the person straight. Mananaso. Moja no be flak on the brain. If you can brain now, or again consciousness. But all you now say the way are all human and sisi so papa. You bet me a check it. You be do CPR. You bet me a check in the pulse. I was saying you be do. But so next. Okay, it's here. Because of time. Me am afraid no be catch me na so you now nti. Catch o iti am yet here. Hello. Nti me am afraid. So na be ya ona me bi huti na wo ankasa rutimi abu obi nti ona me bi hu acha nya funa na wo nsusu abu abutimi abu nipa no just by lying the person down man nipa ne da ho a moja ebe increase akoni ne brain mu o man na no so a ebe increase ne faster na nipa no nyame a obeda wase say e waje me nko a wonya wo du anka mo pacho yate ase the second one is choking. And choking occurs when an object such as food or a foreign body becomes lodged in a person's throat, blocking their airway. If someone is choking, it's essential to act quickly to help them breathe again. Follow these steps for first aid management of choking. Say nipebia ehunu a system yes your body nim your friend respiratory system and it me boa ma ho me say what na system be cause so body nim but what I say it's a whole tract right from when ma go see your chest, so we will be a friend of lungs, we will be a friend of trachea, we will be a friend of larynx, pharynx. See, we will be a friend of a qua cosi lungs. Until we don't say, "O chest, echo up, now go down, echo up, now go down." It's because air is entering right through the airway into your lungs. That's what I say. What makes choking very, 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 very dangerous is it can actually block the airway. A coin now over near in form from a core lungs. So it's okay to make a block it, sir, a coin because only any when almost one tract. But I say to when a quana when you so quana a quadron one tract. But when you know ever join tractor, air core or digestive system. But when also go straight to your lungs. They get to a point where it's a confluence, like they share one area before they actually separate again. What I say into swallow the dinner echo ka umini it will block a corner in from any film. So it makes it very, very, very dangerous. Say we be choking or breath now into me in it can actually lead to something else. That's what I say. It can actually lead to something else. Into a quiet bit to me, abua say, so be a choke, you one. First of all, be to me, I catch and say, be to me, I say, assess the situation, determine if this person is genuinely choking. Look into no matter who say, Nipano a choking. I say, like, or breath, like, what you say, into a breath, or breath or breath. And I feel Nipano episode about no one very faint, like a very weak cough, and then inability to speak. It will be some Nipana sound to me Nkansah, sound crying to me from a member. To who's announced with the emergency, a similar one Nipano. But what I say, until this is now, but until normally posture Nipana any say, or posture say. Nti say ode ade ne ba be ntumi fama ti na abotumi aka and say ombo what the ding nti nipa ntumi ma very strong coughs very 2 3 4 5 eto de bia obo wona etumi ma ade ne ba but ade ne mba e wo say ye ade bi e fe no Heimlich maneuver nti ye fe bi Heimlich maneuver nti e no e one way etumi de boa obi. And it's not the same thing until for adults no quite for akwala ibi awono ketwa omo se quite fasoyema until the akwala ketwa wo nse na ibi abi tsana na ontumi hu ontumi mbo wa quite fasode boa no until okay so bit news now ho it's me nipa. Event. It's now. You be nipa nechi, and then you make sure that you are standing firm. That's what I say. Make sure that you are standing firm because you will to be able to. I don't know be apply pressure to nipa no abdomen. So to me, yes, try so you stand behind the choking person, then you place 1 foot in front and 1 foot behind for stability. Now, what's your nipa say? All right. It's obey first. Obey say. Now what you share nipa no may beneath the sternum crying into Odon Safaha Okoko Hona Okoko to mean say a quine bida ho. So I see her offensive cocoa so would the sick cocoa so into me international nowadays you want to be first see into right hand one our dominant hand with the Basha now the way I support him. What I say? Tinipani say now we apply a very problem. And I cry. And obey J like J shape nose. Obey say. What I say? So you won't say pressure. You are applying pressure to the chest. So the pressure. So once in a way say no, you apply pressure into adena or choking. The pressure will push it out. Just this simple motion can save someone who's choking. Until we are, then I didn't be ever no man or you are not only health professional, but professional will be a gloves, not the mistake for women. I was saying, Naba, Baby, and I only be able to I am and we are no Honsa. But I have Honsa first answer the action. Into normally, Miss Adeno, ever to me, and Uncle said to me, Yaba, or Uncle said to me, Yaba, we bet me in session in the new Yaman. That's your business. Into a total being swa. A total being swa. If you come about, as I say, Nipano, actually can not be a check. By the time I realize no Nipano, yet I say, by the time I realize no Nipano, Edaho, into an osano. Nipano da hose na nipano unu se nipano bless obo home like Nkansah na efin so you say what chokia you just kneel before the in front of the person not the same pressure no nti what I say nti we are msana ade no be funu na aba what I say do you get it nti when so ya na anye ya na so start ade na me friend CPR no nti ene be do nti realize that most of the emergency situations, no, it gets to a point where, say, no matter where then you have to start what we call CPR. And the last thing I make on was Pacho. Say, I call baby. Baby, no, oh, listen, I shall not be in the chest. Until I know, also, no better than now I saw say, now if you are bonnet, that same emotion. So now when bonus say, I don't be free. Naba, no way, Yaman. In Saquano, a Aqualano, Nanko, men missing. Miss Albertan, Nakuma, been paying every in Sisana, just turn the child, and then just apply the pressure at the back. Ebema Adenaba out. That's what I say. All right. Into third one also a bent. Say bibi ashisho. Normally nyama be shishe eja. To the so some chemicals. Be acid be gu na our body and bibi but normally most of the things are you and say eja ashisho. And the first off, say a fear, and they say, I tell you, Obon say, tell you, video maybe a boom, and a jar will be not old Johnny. Old Johnny say, a Johnny Befuna, so you know, and I decide normally say, if you are around such a situation, I'll be catching the Pansamin because old Johnny exposes fire to oxygen. Oxygen, remember, fire now at the more. What do I say? It is a Udrania, it makes the situation even worse. Into this, I say, Sisana be a jaton, Abakacha and say, Obepe be a niawo. Say, only for now, minimum, and no cry to me, Jano. It's better so the Jano not so you may pardon. By the time I realize who in Nashaship because the oxygen is causing the fire to increase. That's what I say. Especially your electricity phone, maybe I know when you jar will be no journal so he manenda for no minimum 1 name. That one can stop the fire from progressing. Into isi sana into sana meka nyama bebe to me Emma obi wo hye. Into first of say when sure say nipa no is safe. nti ade no ma nipa no enya asa even say bia mukase na bibia I ready na nipa no wanhye. The best thing to do is to take the person from the source of danger. Men kwase okwa akwaje nipa no bibia ade no see because it can happen again. So you have to take the person from the source of danger for it to be safe so that you can start your intervention. And I think so wa wo ko bo nipa na so so to me bon ho ban. Na so wo ko akobọ nipa na so ho akohyehe. So so to me bon ho ban. Se be ya wo ko na akobọ nipa na so ho nkyerɛ. Koyo. Enti say ejahyehe ni sia your types of or degrees of burn. If you be first degree burn, second degree burn, third degree burn. This also picture we are all but say almost share presentation may be different. And I mean about share the kind of treatments that will be given to you. Put it there as a show so it's called first degree burn, and then cool inside so just the surface of your skin that had been burnt. Your second degree burn. Into normally first degree no, don't say a honest show keke as a ya, but a moon ya passa. Into your surface, and we be to me a treaty with fee. But your special areas, so when your first degree burn, see the only match shake a cry, and our chest, and our cheek, and our genital area, even in your first degree burn, and you will be a treaty with fee. But if the accounts and our nine kakra and our sick a crabby, and maybe to make treaty with fee. But if it's you have first degree burns on your face, on your chest, on your genital area, at your back, even if you think you can treat at home, you still have to take it to the hospital for treatment. But you say, see, they are now women crabby now, and our chest crabby, and our genital area crabby, and our cheek. Even though I crabby to make treaty with fee, and I say still walk also to me a show. But since I first degree burn, and say, when sat, and I even say, was sick a crab and our night a crab in Abia, a chick a crab because of the burns, obit me manage fee. But you say, second degree burn, no, they say, when some our work a crack, they say, a shame shoe. A shame shoe is announced, who say, this one is not first degree, and you will be and your first degree, a second degree. Third degree, no, they say, white. White, no, a shoe. So intuition has now say, white. Inside white no issue until and they say bed the green is deep into a deep. This one in fact nefi so or shock so hospital near show. But you say even so and say even if it's first degree no nine it's still serious. But you say if it's still the nine it's still serious and you be a bit nefi say me could do sin one man maybe be a hospital na ya show. But you say it's a sisana. What can you do? So for first degree burns, no, what you do is a sisana. We need a free source of danger. Now, what the lukewarm water? You can't lukewarm water between your or tap. You should not run through your tap. Normally, say you should now. You should not be from a cold. You can't use that water. Till you are between your boiling a crabby. Now you lukewarm a honey hawk a crabby. What I say, but you shouldn't tell what I mean. Or tap water, you should know if you tap no between use. What I say, until the beer or one association, until you just run that place under tap water. And obey, you apply sterile non-stick dressing or a clean cloth over the burn to keep it clean and prevent infection. Until obey cloth be very clean, if you be preferably very like white cloth, and maybe a handkerchief beer or the akatasu. Some bear a honey clean and an infection BNC. But you say, normally, no, a see a knife and alcohol junction violet and a cream blution be a diabolical and it can actually bring infection. Until the first period of time, don't think about cream or cream and a lotion. Or the nafa a clean piece of cloth fakatasu just to protect the area. Then you can go to the hospital and then they can attend to you. And then I think so normally this is an idea now be feeling pain kakra. If you are say and shall be jana hona swa. So what you do is you can take medicine till you offer ibuprofen and as a paracetamol. ebetumi ama yaw no aba fam kakra na I mean afterwards no normally first degree burns no if kakra bi wa ha wotna fi abetumi ewu but if it's second degree no normally so na mekan normally essential until you attempt to say in so no be pie no don't touch it, don't pop the blister. Or pop a blister na Roman situation are worse. So do not pop any blisters that have formed on second degree burns. So now na or the very clean piece of cloth or the kataso. So no by infection into me and so or to be so a bit to me ama the man say on sun is a bit to me ama on sun kakra. Into man is on sun so possibility say a honobe ebe hunu aye kese no very no o ma onsa no so a ema e hono twetwe intem nti esisa na mefa onsa to like maso elevated so that the water can drain from the swelling so no be ebe twetwe intem and I can say if it covers a large area or affects the face, the hands, the feet, the genitals, or a major joint. Joints are very important. Say unya shishie or joint, in fact, or elbow, and our knee. Those places are very important because say one may be being found. Now I found cause to mansha. A healing bit to me. Ama healing strictures. It's very soon. We don't say or joints are very stiff. So joints, even if it's first degree or second degree, focus with an because all it's not healing. By the time I realize now. Or joints now very stiff. Opposite what's in some pana iodine. Until Sisana ma young shaman. Okay. Alright. Do not come back. So do not pop any blisters as this can increase the risk of infection. So hono ashin so amen pine or pana ashana infection no aba. Do not use adhesive bandage. When I say adhesive bandage, is a bandage a tale. It's a plaster. Me use plaster. Plaster tale. It's very adhesive. Into me use plaster. I bet me use a nice piece, clean piece of cloth. Or the akataso for me use plaster. And I feel me use cream. So I can me use ointment, butter. And I feel it seems so. I mean for ice. Today I attempt to solve the ice. Ice. Skin so normally no oils are destructive. It may destroy skin cells, so you don't use ice directly on the skin. Normally if they are bit me so bit me I share damp cloth me now they are too so kakra but me for ice into skin so directly that's what I say so how much show maybe I saw the ice for share cloth me na for too so kakra but me first ice no into skin so yet I say so when you blow away from fridge man now the skin so no but we are check very poor cloth now they are to so these are all first aid measures into where woman obet me about bank account or hospital but what I say so me bear you need to me any serious like that. Okay, so our next one is bleeding. To say it will be the second maybe free some shame no more two. And now do your junior kitchen be chow. No more 2 years are bleeding an idea. You are in the so to me so say okay. But like a deep cut, no more 2 like moja by emergency. I say want me and will be by the time we do hospital now, moja number film. Why am I? And I will be said it be caught me film into a CBB a donor obey. And so I say ensure your safety and the safety of the injured person if the situation is dangerous. Example, a car accident or active violence, move to a safe location if possible. And see, when they actually say, "Tony Bia, a bit to me, see what car accidents." Now, mojo 2 it's for every emergency. It's very important. Say, baby now say, "Oh, administer emergency aid." No, a whole is safe. What you say? Emergency be able to be say, "We be a pra no the fam." Make sure say baby or one out person be on the panel who is safe. That's key because the whole is safer. It can actually complicate things. And you have to ensure that the person is safe. And you have to also assess the situation. Tell be an minor. Tell be so mood. Be a severe a gas out. very severe. Until your approach will be different for all the three. And I think so. Say normally in emergency situation, we need gloves will feel, we need gloves, and I will be of that sort. But I say also be to me on fee gloves, protective wear, very. The so-called abundant cannibal on your day. We will fear a very good. Oh, the tree dry crash also gloves now. They are the gloves there. It's something that we should all have. To normally say, Sisana, so also to me born by. Unya gloves will crash and out to me the Kobani Pana a beboa. But you say. So use of disposable gloves. Nothing, it's Sisana, wash your gloves and our born by you. And so apply direct pressure until maybe a mojano a free bano. Or they say, see, I apply pressure. What I say? You apply pressure on that place. Right? And you for most bleeding situation, direct pressure is the first step. Until you use a clean cloth and a sterile gauze. To your cloth clean and you should put there if you are the form and because Obama infection area the system it's a very clean piece of cloth. Maybe a handkerchief be new crown you suda. Now in baby abuja ni phone bano to only to be 15 to 20 minutes. What are 15 to 20 minutes? And yet when you hear can I say moja ni jaya na now say was also be atoso moja ni jaya 15-20 minutes here continuous. Or sana I remember be a friend clots. The clots will form and it will prevent the blood from gushing out again. Just by doing that, to be to me abu be a moja etuno. If you apply direct pressure using a piece of cloth on the side that is bleeding, just by doing that you can save the person. And I feel what's it? Because say a command a pompe moja echo other parts of the body. And say because of gravity, moja can move directly to my limbs. It is saying if I say cat no AC because say what depended on so a bit moja no flow in tentem equal brain in tentem. So say moja no ban tentem now if I say cat no what you can do is you can raise up the leg. Now the pressure less so blood to a bit impaired as in moja na economy a subetic crack. Rather than say the nipanijina or nipan flat. Who is in an cra, the rate at which said moja economy a very low. Say Nkansah, Manisanuso kakra, nafa pressure etusu. Or sir, you can actually help the person. Yet I say pressure. Pressure is very key. Go back. It is even say in car accident now the says nipane moja tuni pano the nipane moja tuni pa and now apply pressure crying. What you can do is bit many friends and cloth and a bandage now above sides na bleeding or better check because you believe say blood vessels no and I instantly moja ni film no if free akuma no into which it's showing na ebe prevent blood say ebe sa area that can reduce the blood but sa it's a bit dangerous because say prevent blood to the other part of the body or the legs into one take care very soon. If blood is not getting to the other part of the legs, it means that oxygen is not going into nipane and I'm able to start to say a pro it I say into normal tonic a last resort is the last thing that you do. Say, oh, to chill and how to chill the area above where the blood is coming. Is the last resort. Normally, pressure is okay. But if mojano bad, now apply pressure, just tie the area above where the blood is coming from. That can prevent the blood from coming. But we say, we do hospital 10. We do so to catch up doctor to say, oh, 5 minutes ago and 10 minutes ago, and I had to chill the area above that site. So now doctor will say, oxygen to that area has been deprived for about some minutes. But what I say? In terms of apply around the and the area above, and yes, I just apply pressure. So moja no bag the now what to tree. we do this so say catch doctors and say see and see into na chichire the nine so but you tell assessor koyoko and once I bleed in agile then you can clean the wound gently if possible and apply sterile bandage or dressing to protect the area until a honey chana what stop it bleeding bleeding agile just clean the area which mean address solution and I be what the other one come now if you what bandages so what you say and okay now if you wash your lip and you monitor the person say the person you're okay like or she moja baby or okay but you nature say the person to me hospital what you did was to give the person first aid to help save the person. All right. Okay, into last but one. To a fracture. Because a fracture I say if you are obi don't pay me the nine more in some way and I will be so Ekwamba na abon se nipa no ebia ne nan mu ban de mpemu abu normally se wo hwe ebia ne nsa na obehu se afetre anase won se me nsa ne street obehu se ebia na wo hwe oyo ne nsa ne se obehu se ne street biom nti won se achia kakra anase ho na soa ana ho ne ne ya pa nti se bibi se asi obehu se de mpemu abu ana bibi sa akoso. And so what you do is first esia nya fe na be won say now moving inside now if the first thing to do is to immobilize it into the manner is stiff, don't move it around. Move it around that it can complicate the fracture. Which now the normal fracture no I serious more and the man panisa no I na more and an nine into esisa na just try to keep that area still, don't move it. Manage stiff will be over so you immobilize it. And normally the habit me and say bit me na ebia wood kakra be like any heavy, too heavy, like 10 piece of wood. To the shiny panana sia, to the 29 assia. Now the cloth the assume. Now manipanin the 9 assia and sa or the splints and our wood no beshan and sana assi. Now the into maybe album. So never any panel and son better was say about stiff. The thing doesn't have to move around. That's the first protocol in treating fractures. Don't move it around. You move it around, it will become more complicated. All right. And so normally we say that nipano or she and our shiasi and an insamo bubua and bubua. Normally we say or she say no con involved and an spine involved, it can be serious. So the neck doesn't have to move. Men chinchin the con and abibisa because which chinchin the con it could affect the brain. A bit paralyzed or anything of that sort. So the neck has to be very stiff. Men moving the corner. Into my nipan that was straight. Now mobilize the area now a fracture. If you touch the neck, if your neck is involved and you touch it, you can actually complicate matters. Into the neck has to be stiff. All right. Into one Nkansah to me support the area. You can hold the place now fracture with your hand just to immobilize it. So that there are fracture points no aim movie. And I feel so say a 9 and an inside. But to me I elevate into what the splints no na eduana show now the to mano attitude. But to me I elevate inside like cra. Don't move it. But to me I elevate like cra. And an 9 like crab. So there in soon better tree. A one no answer. That I say. So now there swelling. The swelling will not be significant. I feel so. Say then some ebu and an ebu your vessels, blood vessels, and pipes be a moja film echo ye 9 aseni and sa aseni other. Normally say fracture is serious a bit to me a cat some of the vessels na moja ne fam nti ebi a mfa say ohwe nipa ne nan odon sa eto ne nan asena ehwa enyuna to me say moja mma ho ase moja na ewo say eba ho no because say don pele bu no akate moja no nti moja to me enko ne nan ase is very is an emergency so we rush in the hospital. It means that the blood to that area has been cut off because of the fracture. Until with that, infant nephew, Johnny. For all fractures, me infant nephew, men can say, but they call herbal, oh my mammy. Herbal for every fracture, say, don't pay the the way the manager hospital are different from the way don't pay the what I say, don't pay the different from the way the manager but herbal for no. Omo one way on be manage bibia nti the other way na wa manage some na from sana Stephen to me movie and I bibisa na sana kwa and I bibisa about the hospital they know that ahase no the management ni say ahase no management ni say nti na mubu and I say mubu a na friends na fi na nya won herbal champion fa ko hospital ni yenya mawo me so o ko so na ka say so she POP there 6 weeks some months also comply now here because once the place is immobilized with the POP no e ma e ho no heal faster go otherwise me the person say POP no ba ko ne ka say we we say do to ho na ye hango na we 6 comply because I never bo but you say do you get it nti say obi na mu bo a ana me say mu bo on kwan abefa so abo nipa no first aid onye doctor no no man na make e ma onye doctor ma wotumi aboa obi a no ho akye no before say doctor ebebem pacho yeti ase nti wo fi a onye doctor Mary ana doctor yi nti pacho wo fi ha o knowledge say obetumi bi aboa obi answer yakohu doctor pacho yeti ase ebe yeti o na say for doctor as o doctor nyama ho nti pacho yanko this is very important. Nti esia men try say obeka bones na nti even say ebuna ahase no acha kan say men try say obeka bone. No, don't try to realign the bone because you can actually worsen it. Just immobilize it. For slab measure for cloth no echiche no. What the cause is under immobilization. But one kasa obese o kan don penisi so. Answer all the akwa ansha na akose asa asem no. The men try say ahanebu no say hase achianti me carbon but your men sir just hold it in position for hospital on the any akam let you say all right into ne sa no first aid tell be into esisa na ebe na ya into betumi akọ paracetamol ibuprofen na odi ama no se nipa ni all sa betumi ibuprofen bi ama no na wafa but normally paracetamol betumi okay ama nipa no na afi wode na ko hospital na yahwe no until the last one we last one we na your questions until last one here cardiac arrest and a heart attack very very important something that we have to know. So cardiac arrest is a life-threatening medical emergency where the heart suddenly stops beating into wakoma na air pump moja to other parts of the body na ejai into me nyejuma biom. Into you can imagine if wakoma na air pump moja na ko within wajin mo nai wonsa ejai na say bibia akondem. So the heart stops and the person becomes unresponsive and stops breathing. Immediate action is crucial to increase the chances of survival. Here is how to provide. Into normally no say before we bring heart attack, we say be only panel eto and I'm power doma. Obe start complaining some complaints we are say there is a heart attack. That's what I say. Into normally no start obe feel say be heaviness or feeling heaviness or normally your left arm. Into me left arm no I very heavy like I heavy or feeling some here do me tell you not feeling like numbness on the left arm as on feeling the left arm. The people start complaining say as me feeling so like I have very numb I hate to treat I feel so. It's normally no it started free shoulder na akura the left arm. To the so feel tightness. When it as a greater D and as the greater D abon akum so feel say na kum mo tight. To tightness. To the so feel difficulty breathing. So like or like or breath so be me. Now feel so na me who think free. Who think free be say I say if I'm more how about one class who think free like uncontrollable. Last one so I say Ofori say obabu. Normally no, these are some of the symptoms so we do not heart attack utumi. So first, Nkansah, the left arm, normally left arm. Now tightness. I say the chest no I tight. As the grade that be bone akumem. Very tight. Now I feel difficulty in breathing. Now sweating, perception of death. Into nipa no complaining when we now only say all of a sudden nipa no if like the person is not is unresponsive. Now we say heart attack is what I say. Into nipa no to her and I'm nipa no with them. Now I started to abro be a hawk already complaining of all these things. Then all of a sudden Nkansah like nipa no call off obo no crown and say then you realize that heart attack is so you have to help the person and yes nipa no baby it's a bit flat because the heart has stopped pumping and your heart is the most important part of your body because when they pump blood to all the parts the heart no stop here the be here but what I say is for such a person now be yaman no any CPR na make kan wasem but what I say it is CPR. All right. Into first, answer the statistical CPR and I saw your assessment. All right. I saw your assessment. I saw to me assess any panel. Indeed, moja eguso cost one body no more. Into first, the other say ubutu ni panel entrance here na one man ne okay. Normally I say me join say but because of Monty. Into uma the team so cause we say now your vessels be waha to do sa eto ha we to no sa to we say ebo the carrot what anya ko how faba what you about you na se kakra Ofori but you know too no atusu Ofori oh yeah sure the answer na me dey pastor mu so no carrot pastor mu ebo David eba I mean introduce to abon say ehonebo it is a omani pano it is say now o check na embo say heart no ejai pompe I say moja bi eni wa efri akomani no aba adrenim so it's an emergency so circulation has been tempered with all right after so we to the so anyam ebi na choking man na what ahwe so we hwe nenum airway we say bibia ni wa a block in the airway na after so we are able to ese me gina say that because of Monty na me gina say so ba na wa hwe ni say until obebu to say na wa hwe ne chest but you dey che obehwe ne chest say a movie up and down normally we say sisa cardiac arrest na want to mean breathe in the chest and put it enko what I say obe try so obe bono all feel unresponsive ti say o check sa nyama no check ha normally betimi a check ha say so ba ha say no vessel no esu into normally no say eni ha what I say betimi a check ni say but say moja bia on philippos bia o ha you won't feel it here to check ha say now check na num you be any ho now check o you say now check na akoma no chest no move up and down na so start CPR but what I say the CPR no nti your friend no cardiopulmonary resuscitation nti it's normally what you do is say, right? What says yeah. Now the way I show. Now I interlock it's for support. Alright? Now baby na we no the share no has no. To the share and I say so on sa wo I say a friend say on sa yam say so right to interlock now after we apply pressure to be say when we say go for you be right nti ya no oh yeah you say and you say na you say no I say pressure no free ha I say movement no free with shoulders right nti o de si so a nti we chest compressions right normally no in a minute they say to me 30 chest compressions now oma 2 breaths nti ebia na on say odo yenum be show bi yenum but emergency say say utumi bi asin chain na cause normally say no hospital set an for yenum nhye wenum normally your ambu bag e betum be show na yemia ba ebia abonten so na ebia nipa na bre ubetumi ayesa but on person oyesa na say only training for that you can just do the compressions alone can help. What you say? Inti within a minute, 30 compressions. Within a minute, inti staying alive. So movements from the boss animal. Inti inti staying alive. Staying alive. Because we are to know. Because we are to know Baby. Because and you now almost it's like a song for CPR. What I say, to let me to argue. So I'm and yes, many say, when you say pressure down, what do I say? It's coming, I say stiff. Now I'll cotton tea. What's it? I'll bet you answer no actually. It's normally no hospital no mean you bring the DFN no ambu bag. See you make compressions now. Me am 2 breaths. And I want to say be able to to the shahana 1 man a breath 2 no other to also to be obrena obi so around or no so enum ya no so abeto aso sinisa o no sa betumi abo nipa na kwoti se obi a ana sans health social betumi aba abo no but what I say if you are working na if you are nipa na hospital cry in the car betumi na o na the bo nipa no before somebody do hospital no obetumi abo nipa no se ne be a nipa ne be nya nkwa. Yes, I would say after a few minutes, 5-10 minutes, you panic. But all I say, the fast now to me, Buani Pana, CPR can actually save a person. Nani Pano, any unquambium. But I say, one of the kind in choking, it can come to a point, say, Nipano circulation, a source start CPR. What I say, then make CPR from the start. Into more choking, when you na Nipano toughen, or you're not still Nipano very unresponsive. You can start CPR, means that the heart has been tempered with. But what I say, all the emergencies, no, if it goes to the far extreme na nipa no unresponsive ohwe ahase na ohwe na the chest na rise here, that mean that you have to start CPR. When you CPR now, you can save the person and then you can save a life. Amen. And see, you're the best here. The CPR. PowerPoint now, okay. All right. All right.
At your time, if you have 3 questions, please.
Yeah, the master said.
So we are man for try CPR. No matter.
Yeah, the master for this. But we see running water burn. No. Yeah, normally say baby buy you the kind of chin a good so near the empty. But I some me phone could be unfastened. And China don't go so no, you bet me the gumana.
I mean, normally, it's advised. Say it's better to do clean water. Don't even use soap. It's better to just use, because water in itself is potent to wash away everything. Salt and a BBS of that salt. If they are later on, if the salt is recommended by a health professional, which may for salty, but AC and no one, just use water to just run.
We hear pressure. Somebody must stop here and look at another banner. Maybe so. Cat, my any yadda. And I say, yeah, crew, and see how. Say, cat, try to close cat, and as a mianeke.
And see, the opposite way, say, body no, the body and error, its own way of stopping bleeding. All right? And he say, Ujani Panawa. The bleeding can go on and on, but eventually the body can find a way of stopping the bleeding. All right, but just the opposite way, say, "One person in Panama shrimp because by the time you are bleeding, like I say, the base may the normal to acquire normal stop bleeding. Not maybe a late. Then the Panama shrimp can be. So what you are doing is you are trying to help the body form the things that it's supposed to form to stop the bleed. So I say, for me, be a friend of clots. It's a clot no. For me to say some spongy substance be now cover the surface of the cut. And what you are doing is you are helping the body form the clots quickly. You get it. It's anywhere else you have to apply the pressure just to help the place. Nkansah say if a cut it will be for pressure so if a cut it will be bleed cry it be check. But a cut akuma moja efumu just apply the pressure. It will help. All right. The last question. Okay, Pacho. Mr. Pierre.
God is good.
All the time.
Doc, I want to find out from you that is it cardiac arrest have 2 types? Because I experienced some, that's what 2017. Whereby the person was breathing, had liponomic small. And later on we use a wet cloth, put on her chest, give her milk before it stopped. So I want to find out from you, say cardiac arrest.
Okay. So I get. So was it asthma?
So he said cardiac arrest.
He had what? Hole in heart. How old is the person? Well, I mean, I don't know the presentation very well, but I mean, this is the classic presentation of cardiac arrest. Sometimes things like asthma, all right, can also present in that kind of way. Asthma and so many treatments here are different. If you have asthma, na bibisa nipa no normally your man inhaler. Until sana immediately the way which me abon nipa no say obefa ni inhaler no obetumi abon in so many ways. Sani pano ewo adanfo bia no oni bia na baby or asthma catch and say the baby obeko bia ni inhaler no say onya on home because anything can happen anywhere. Bo or na air condition mu crack can trigger it. What you are saying is nkofo no normally na inhaler always has to be with them, because you may never know when an attack will come. To Adam for be an be an bisa catch and say, maybe I could be an healer because it can help you, it can save you. Patriots here. Recently, I mean, I do in the clinic, you cannot find healer, but very bloody. Patriots can you be like a healer around and can you pan do? Patriots here. See, to do asthma and idea like inhaler day, you can't go anywhere without it.
God is good.
All the time.
Patriots, who can say, Ebia, who could say, Ulubiti ho, na Sane Mani Sisi, Nani Pana Trash, na wako man and answer. Me pese bisabia ma ba besra no me bai na saade NSC na ma kobono nyame mfa sa amba na nipa no nyame agi ne nkwa afi na doctor for wa be ye test say ye pese de le si ye ho na ne nsa kan ya anase me nam street so na nipa na twa hwe esida ye baka say be ye ayi what do you call it? Almost friend bibi afa na ombe say ho na de ne nsa fingerprint na nema obi car cramp out mi ko so ma ye trace ba be de abechi mi to so da car no e baka oh asama si na de ne nsa be car no first and na ombe chi mi say am fa me nsa Nkansah ye na third no so nipa no say na so man na so ya be ma no ya ba ye what page na say so na me kono obi yire chewa na page and so also say utim so I say
Okay.
and until say
Alright.
me da say
Okay. And you know Canada. Normally so obi wu a no mo ye define the cause of death, you find autopsy. Until no it's not on the body, it's inside. Until test number 1, it's stuff that they've taken from inside. What I say, until if say hypertension, I be no kuna when the case on sana the can. Doctor B no the case on sana the can into go kubi. What I say, until that notion say because boy pay now BBC no would what is all boy nipa no obinya nkwa. What I say, until sa obi ankase odun sa hoka would be there be an aspect of the law that you were there, something of that sort, and but in that emergency situation everyone knows that. I mean, if the person was your brother or sister or a friend, you were trying to offer help. What I say, that's if you know that you can actually help. What I say, until just raising the leg of that person is not enough to kill the person. What I make understand? And I feel so about emergency. Oba until sorry about that was it. On found said baby emergency until you know I'm missing my sabana for bono. Patriot say for emergency. On sorry my catcher say obi nikunu make and say me yere na akọ pagana na on kwa baba was say eh o kwa wetin ya ba me can you say we patriot that is what again I know you. Okay, the last question now my demonstration.
Me pacho, me sun bisa say. Mapa. Pacho bisa say. Say obi ko I say obi collapse. Ma hu vida. Omo kwoti into sahaban. No mo dia so nimpa no obi so no asa nsuo ni e dia gu nimpa no so se nimpa no nsore na mpacho no so etumi ya adwuma saa na
you dey say fedu sin for na on be answer but I mean I've seen instance say dia nimpa no try to do nsuo gu no so it can make the person alert. There are times that there is a place for that one to be a adwuma to be so adwuma. It depends on what is actually causing it. I mean, that thing is not out of place. Because today in Sonogonus, like a money emotional, like a money panel come alive. Sometimes it works. But you begin a juma. What I say? All right. And it's not for any panel. Now, I'm a demonstration. I'm
Okay, thank you very much. My question goes to the issue of the amputation. It's not amputation. The one that you have a fracture.
Fracture.
Yes. So you recommended that it's always good to resort to the hospitals rather than the traditional or herbal base. But experience has proven that when it comes to the bone aspect, usually I see that if it is major, sometimes the traditional people are well to do in treating those, because before the advent of medicine and all that, the local people were already, they had knowledge on how to handle such issues. So I see, even as part of our communities, you go to the hospital will do it, but you still have to go to the local people. Sometimes they have to break it again and then reconnect it, and it fixes. The classical example was one of my nieces got an accident, a Kaya lady, and the car ran on her, and he was taken to 37 hospital. When he got there, their decision was to amputate the leg. He said they cannot do anything unless they amputate it. So I got there, and then back and forth. We had to transport her to the north from the hospital. So we had to buy the whole of STC back seat and put her there and carry her, because the car has passed through the leg. But when she got there, they work on it. Now she's walking. She's fine. The legs have joined. But they insisted that there was no way they could do anything. Their decision was amputate or you take your patient. So I think that sometimes we cannot totally ignore the traditional aspect when it comes to the bone missing, because the hospital they just put some bandage and something and hold it, and those things, I think for me, I don't know what you want to say about that.
So when it comes to medicine, there's always alternative medicine, all right? There's always alternative medicine. So alternative, we have the homeopathy, we have the traditional, we have the acupuncture and all. Those are alternative medicine, and it works for some people. You get my point? But the point I was trying to make was that normally the herbal, they have like a straight-jacketed way of treating things. So if it's a fracture here, a fracture here, a fracture here, they treat it all the same. So sometimes it may lead to some complications. But if it was done in a hospital, then they know that a fracture here, the way we treat a fracture here is different from the way we treat a fracture here. It's different from the way we treat a fracture here. Of course, in the hospitals, we've had people come. When I was doing my surgery rotation, people come, and then when they come, they are like, the person has had fracture all over the body. They said that we should just treat the face. We should just put the bones in the face together, and they will take the rest to herbal. And then we ask them that, so if you are taking to herbal, why not take the face to herbal? You get it. So people have their alternative forms of medicine, and it works for them. But the little advice that I'm saying is that the herbals can sometimes lead to certain complications that you wouldn't want. You get it. So most of the time, just you go to the hospital. If they say they won't do it, and then you want to go to the hospital, you can go. You get my point?
I think one of the things we should also insist is the specialization within the hospital, because at times some hospitals may not have that specialization. So this at times local hospital not social specialization in the WA as much as you can. Ask for a referral, because there are some places they are just on the bones and they can do well than maybe 37 that they don't have those things. Thank you.
Okay. It's in patro eme nti ebe frɛ another episode ya mansaso na men frɛ obi an volunteer am frɛ ebe see chest compressions no ekwa abefa so aye no na mama ke mo ahwɛ Koko nasi. What's it for? Why is it? Kaka, ebem. Acho que vamos semana, vamos semana. Ofori. For youth, but try to show. The last thing, yeah. Hacemos semana. Isla, Nicolás. Repartição. Não foi. Vamos agora. Acabem. Esse agora foi. Dobra, o bebuti. Beleza. So let's look. So that was a while. That was it. It's in the way I say, most of you know, not me anything. But you see. What is a skill? So, I have any movie. I have a stiff, straight, right? What I say? You are tempted to do this. Yes, sir. All right. But you must have. And see, you're the best here. You are playing. Your MC be better also. Listen.
Enti ase wani nje. Yesi anya ma bebe. Eden na catch a doctor. Within a space of 1 minute, in please and cut insurance and so. Just 1 minute.